Now let's talk about hypertension. Hypertension is the persistent systolic blood pressure of greater than 130 and diastolic blood pressure greater or equal to 80. So what is normal? 120 by 80, right? So if it is greater or equal to it, I guess less than 80. Let me actually double check this thing. Hypertension, yeah, less than 120 and less than 180 is normal. So normal is less than 120 by less than 80. That's normal. So anything above, you're looking at hypertension, but you have to have a persistence of that, meaning in couple checks you're looking at that BP to be high. Okay, what are the risk factors for hypertension? Well, the risk factors for hypertension are increase in age, obesity, diabetes, physical inactivity, high sodium diet, excess alcohol, tobacco smoking, family history positive, incidence greater in black, greater than white, and greater than Asian population. So blacks have more than white, and then the Asians come up. What are the features of hypertension? 90% of hypertension is essential, the primary hypertension. This is primary essential. And related to increase in cardiac output and increase in TPR. So that 90% is all about your increasing the cardiac output, increasing the TPR. So guess what? For that essential hypertension, most of the treatments are going to inhibit this thing and somehow inhibit, or some drugs would also inhibit the increase in cardiac output. That would be the focus, right? The remaining 10%, so 90% is the major amount, right? Which is essential, like idiopathic. You don't know the cause. Primary essential. And remaining 10% is secondary to renal. Let's change the color first. Renal or renovascular diseases, such as fibromuscular dysplasia, high yield, which would give you characteristic string of bead appearance on renal artery. Picture A. Look at this string of beads appearance. So there's a string and there are beads on top, and that's the appearance it gives you of the renal artery. So you call it fibromuscular dysplasia, and usually it is seen in females, adult females. And the second one is about atherosclerosis of the renal artery, of the atherosclerosis, renal artery stenosis, atherosclerotic renal artery stenosis. Other than that, you're looking at primary hyperthyroidism, not thyroid, my bad, primary hyperaldosteronism or aldosteronism, right? Or OSA, which is obstructive sleep apnea. So let's just look at these causes. 90%, so let's just do this. Wait, make things easy. Coloring. 90% is just essential due to the fact that you're increasing cardiac output and increasing the TPR, total peripheral resistance. 10% is due to secondary to couple diseases. For example, fibromuscular dysplasia, one of the thing, right? For example, atherosclerotic renal artery disease stenosis. For example, primary hyperaldosteronism or OSA. So these are just the 10%, and 90% is different. So what else do we have? We have a couple more terminologies called hypertensive urgency and emergency. Urgency is that it is just severe, greater than 180, greater than or equal to 180 by greater than or equal to 120. Hypertension without acute end organ, without is important, without acute end organ damage. So the way it is just you have a severe hypertension, nothing else, without any damage to the organ. Okay, but if you go into emergency, what's going to happen is formerly called malignant hypertension, that you have the same hypertension, which is your greater than or equal to 180 by greater than equal to 120, but on top of that plus with acute end organ damage. So what are the organs that can get damaged? They are, for example, you can have encephalopathy, stroke, retinal hemorrhages, exudates, papilledema, MI, myocardial infarction, HF heart failure, aortic dissection, kidney injury, microangiopathic hemolytic anemia, eclampsia, arterioles. Now, on histology, what you will see is arterioles will show fibrinoid necrosis. Fibrinoid necrosis will be seen. So hypertension is going to predispose to coronary artery disease, left ventricular hypertrophy, heart failure, AFib, aortic dissection, aortic aneurysm, stroke, CKD, which is hypertensive nephropathy, or retinopathy. Okay, let's just review this. We're looking at hypertension. Hypertension is again greater than 130 by greater than 80. Risk factors are almost similar to whatever you see in your cardiovascular diseases, which is increase in age, obesity, diabetes, physical inactivity, high sodium, high alcohol, tobacco smoking, family history. The race is also important. In black, it's greater. Blacks have greater chance of getting hypertension than white, and then the Asians are the least to get hypertension. The features are important. 90% is just primary essential hypertension, in which case you're just increasing the cardiac output or increasing the TPR, while the secondary ones are due to some other secondary cause, which is about 10%, in which case you have fibromuscular dysplasia of the renal artery, which will give you the string of beta parents in adult female, high yield. Second thing, you can have atherosclerotic renal artery stenosis, high yield. Third point could be you can have high aldosterone due to primary hyperaldosteronism, high yield. Or the last point, you could have it OSA, obstructive sleep apnea, in which case you just have hyperstimulation or hyperactivity, I should say, to the sympathetic nervous system, causing hypertension. Now we have two sorts of definitions, urgency and emergency. Urgency means it's just urgent, meaning you have a high blood pressure greater than 180 and greater than 120 without any organ damage. But if you're looking at emergency, you're looking at the same blood pressure, but there is an end organ damage. What organs are we looking at? Are we talking about? We're talking about all sorts of organs. For example, if you're talking about brain encephalopathy, stroke, eyes, retinal hemorrhages, exudates and papilledema, high yield, papilledema, high yield in hypertensive emergency, an MI, heart failure in the heart, aortic dissection, kidney injury, MAHA, which is microangiopathic hemolytic anemia, or eclampsia, high yield. On histo, you will see fibrinoid necrosis. This can all lead to same thing like coronary artery disease, left ventricular hypertrophy, HF, AFib, anything you name it, it's there, right? And let's talk about now one more thing, which is known as isolated systolic hypertension. Systolic hypertension. So as the name suggests, that in these patients it's just the systolic which is in hypertension, and diastolic is normal. And what was normal? Less than 80. So what is the systolic going to be? Systolic is going to be greater than 140. Okay, so you just have isolated elevation of your systolic blood pressure with normal diastolic blood pressure. Why did this happen? It is due to it is seen in old age. What old are we looking at? About greater than 60. and it will just cause increase in cardiac output. Okay, or two things actually. Either it's the old age, or either you're just increasing the cardiac output. These are the risk factors to it. So when you what's happening when you increase the age? Let's talk about that. So when you increase age, which is, let's say, greater than 60, what's going to happen is you have stiffening, arterial stiffening occurs, which is caused by endothelial dysfunction and extracellular matrix composition. Uh, Change in extracellular matrix composition, meaning decrease in elastin and increase in collagen. So there's a decrease in elastin in older age and increase in collagen, and that causes arterial stiffening. And this increase in arterial stiffening decreases the compliance. What is compliance? Distensibility of the aorta and main peripheral arteries, causing increased pressure in the during systole, increased pressure during systole. So this is due to the fact that you have increased the age. The other was increase in cardiac output. Let's talk about that one now. Increase in cardiac output is due to the fact that you have some problem that is causing the CO to be high. What is the problem? The problem could be you have aortic regurgitation, or you could have some systemic causes. Systemic causes are your anemia, hyperthyroidism, so increase in thyroid. Okay, and that is all we have for increase in cardiac output. So let's just recall: isolated systolic hypertension. It is due to the fact that you have increase in age greater than 60 or increase in cardiac output. So that age would cause arterial stiffening, and increase in cardiac output would be due to the fact that you might have an AR, or you are just increase in your thyroids, so hyperthyroidism, or you're anemic, which all leads to increasing cardiac output. And that is all for hypertension.